I'm going to show you a very cool concept about facilitating behavioral change. You know how I've talked about that? I use that term a lot, facilitating behavioral change, helping our patients discover their path. So here's an illustration that I want to make for you. Everybody's got one of those, right? Fitbit? Okay, now I want you to think about this. Let's just say, for the sake of discussion, that a Fitbit, when 12 o'clock midnight strikes, all of the data in the Fitbit just disappears and it resets back to zero, okay? There's no storage, there's no cloud, there's no nothing, okay? It just tracks your steps and at midnight it disappears. My question to you is, how effective, what would the effectiveness of that Fitbit be as compared to the one that we're all familiar with that tracks your steps? It's on your iPhone, it's in the cloud, you can engage friends in competitions. What's the difference in the behavioral change in getting you to do the 10,000 steps a day? I would say that if that Fitbit just cached and just destroyed all your info at midnight every day, I would say the effectiveness would go down 80%. Okay, so it's the experience of the information that is what makes it valuable. So I'm watching TED-Med, and there's a guy named Thomas Goetz, G-O-E-T-Z, and he talks about how we in medicine and dentistry present our information to our patients and how it needs to change. So he got a graphic designer and he spent $30,000 to change the forms on how we communicate with patients. So I took a screenshot and I literally just copied it exactly. And since that podcast that he did, I have noticed that the Cleveland Heart Lab has now changed their forms. They're much more colorful, they're much more intuitive. If you join my private Facebook group, Pathogen Lounge, I will have this form there. But basically what this form does, and this is exactly how the medical looked, but I just made it for dentistry. And it says, Caries risk assessment, desirable, borderline, high risk. Periodontal risk assessment, desirable, borderline, high risk. Sleep apnea, desirable, borderline, high risk. And then here it says, what do your results mean and what can you do? And so by changing the way in which we communicate and making something that's colorful and intuitive, will engage our patients just like the Fitbit, because we can follow our data. We are much more engaged in our healthcare process. I hope that makes sense. I think it does.